Hi, my name's Tracey Bell, and today I'm going to do a very quick demonstration of an 8-point lift. With an 8-point lift, we have different parts of the face that we inject with a very small amount of product. It produces a very, very nice natural result, and really the aim of it is to rejuvenate and replace the lost volume in the face. I explain to patients that we always start like hanging a curtain. So we start within the cheek area. CK1, CK2 are my favourite spots. CK3 is where we start to get separation of a fat pad. Normally, you can see it in women and men as young as 25. In Lisa's case, she's had some Juvederm products in the past. She's had other procedures as well. She still looks like Lisa. And today she's asked me, can I have a little bit? I hate my nasolabial folds. So that's the fold between the nose and the mouth. I said to her, yeah, but Lisa, we need to lift, remember, at the back. So today, I'll probably use 2, maybe 3 syringes of a combination of Voluma, Volift, and maybe a Juvederm 3 or 4. Again, very natural result. It's her lunch time. She's about to go back to work, yeah. So again, I'll demonstrate. Okay, so again, I've cleansed the face. We have CK1, CK2, CK3. I'm going to augment this area to reduce the nasolabial fold. The product that we always use is Voluma. And again, if I was a patient, I'd ask them, is it an allergan product? Yeah. Has it been prescribed for me by the practitioner? And then go from there. Okay, so very simply, people ask me all the time, how much do you put in? It is completely dependent on the patient. So in, we aspirate, we pull back. We then inject. And on this part, CK1, I'm going to put 0.1. Very, very, very small amount. CK2, stretch the skin back. And again, down to bone. Aspirate. 0.2. Lisa, how do we feel?
Fine.
You okay? Okay, so instantly you can start to see me rebuilding and pulling the skin back. I'm then going to go into here, and what I normally do, again, down onto bone, sharp scratch and in, deep injection, aspirate, and I'm going to put 0.2 in here. Lisa, how do we feel?
Absolutely fine.
Same injection point, I'm going to come up, and again this is specifically for Lisa, and I'm going to put another 0.1 in here. How do you feel, Lisa?
Absolutely fine.
Okay, and we take out. Okay, little drop. And again, what I'm going to do, I'm going to feel my orbit, and I am going to pull up. Lisa's an exceptional patient. You okay, Lisa? So again, just stop that. Okay, so Lisa's asked me again that she doesn't want nasolabial. So again, we have to be very careful as injectors around this area, and I am using Voluma. So I go in medial to the nasolabial line. I go down almost to bone. I aspirate. Make sure I've got no flashback, and then I'm going to inject. This is an area that people have to be very, very careful of. You okay, Lisa? How are we doing, darling?
Fine.
Okay, 0.2. And then what I'm going to do here, if we look, yeah, got a little bit of loss of structure here, but she wants me to fill this nasolabial. So what I'm going to do here as well is I'm going to come in and almost eyeball, and I'm going to come in and I'm going to fan back, and it's a deep injection, it's Voluma, and that's 0.2. Okay, how do you feel, Lisa?
Fine.
Okay, so I've injected the product and I'm going to mould. Yeah, you okay, Lisa?
Absolutely fine.
So again, CK1, CK2 to lift. I always explain to the patient the product will swell slightly when it's injected, especially in a lip. In the cheek area, it's not too bad. The thing is as well, the patient can often feel the product from up to 4 to 6 weeks later. And I've had patients coming back and saying, you know, Tracey, I can still feel it. But it's important to tell them that, but it will integrate, yeah? Okay, Lisa, I want you to sit up for me. Okay, so again, if you look, CK1, CK2, nasolabial, and a little bit in here. So can you see that this part, and that's with one syringe. Okay, so remember, same again, stretch the skin. Look what I want to do. I want to lift back. So CK1, in, down to bone. Pinch, aspirate, and in. 0.1. You okay, Lisa?
Fine.
CK2, pinch the skin, in, down to bone, aspirate, 0.2. Every single woman, yeah, and even a man, likes to have their cheeks enhanced, as long as they look natural. Okay, down to here, remember separation. I want to lift this back, so I'm going to go in. You okay, Lisa? Down onto bone, 0.1. And again on this side, I'm going to pop a little bit here, 0.1. And the product that I'm using is Voluma. You okay, Lisa?
Fine.
Remember, everyone, nasolabial, down to bone, aspirate, injecting, 0.2. How are we feeling, Lisa?
Fine.
Okay. And again, Voluma. And Voluma, you know, if you can use Voluma in a lot of conditions, it's a brilliant, brilliant product to use. And again, here. Okay. How do you feel, Lisa?
Fine.
Okay, can I have a little bit of arnica? So again, what I've started to do here, there's a little bit of anaesthetic that is also in the, turn this way, Johnny. There's a little bit of anaesthetic that's in with Voluma and Volift. So you'd explain to the patient, say, look, it's normal. After you've had this procedure, you may feel that it's a little bit numb. That's completely normal.
It feels warm.
It feels warm. Yeah. Okay, so if I look at this, look how deeper her nasolabial is on the left-hand side. So what I'm going to do now is I'm going to come down here with some Volift. I'm going to add a little bit underneath this periorbital rim. We're going to lift, yeah? Okay, this side, the right, is much better. Okay, so again, what I'm going to do here, a little bit in, just to try and create this lift. And then again, I demonstrated that she's deeper because everybody is asymmetric. So again, the product in an ideal world would put the same either side. So what I'm going to do here, I'm going to go in with my Volift. I'm sort of in at a 45-degree angle. And again, look, I'm going to fan down. So again, in, fan across, like so, and start to fill that valley. Again, Lisa, I'm going to lift you back here a bit further. So we're going to go in and down and across. Feel okay, Lisa?
Absolutely fine.
Okay, and again. And also what I'm going to do on Lisa here, their mouth turns down slightly. So again, just to give a bit of structure, with any product Volift that you've got left, I'm going to come into the corner of the mouth and I'm going to fan it down and across. So what happens, we have a small muscle here and a little fat pad. And as we age, you know, you've heard the saying, down in the mouth. Try and look happy. And it's because this little area of fat disappears. So, that's Lisa. Procedures took around about 10 minutes. Lisa, again, is an exceptional client. Just clean the area, massage. I always tell the patient, I said, look, you will be able to feel the product but leave it. You know, don't massage, leave it. The products will integrate and we can go from there. Okay, so the procedure took about 15-20 minutes. The planning is by photographs to begin with, consultation with the patient, and a decent product. Juvederm will always give you this beautiful little passport. I always tell my patients, take that, hide it in your top drawer. If you go anywhere in the world, you know what product has been injected, you know where it's come from, yeah? I see lots of patients that come in that they do not have a clue where they've got the product from or what they've had before. Today, I used 3 syringes in Lisa. Again, that was to start what we call the 8-point lift. So remember, CK1, CK2, CK3, a little bit into the nasolabial, but it always start with CK1 and CK2. The product will be there for about 18 months. The results will get better and better. I like the whole idea of neocollagenesis, no allergy tests, yeah? And the patients in general, as long as they're consented with correctly, are always happy patients. Thank you for watching, Tracey Bell.